Hey everybody, Dr. Derek Alessi, and I apologize that I haven't sent out a message in the last couple days, but since Wednesday, what we've been doing is integrating our clients back into our new protocol, and we're incorporating both the physical fitness component with the nutritional component that we've been doing all along. At Dr. Derek Health and Fitness, I am not a gymnasium, I'm not a fitness club, but what we are is, well, I'm a nutritionist and also an exercise scientist. And our designation is we're able to operate, since we work as physical fitness consultants, physiologists assisting people with their ambulatory physical needs, their movement patterns. Most of the clients that come to see me are between 40 to 75 years of age, and they have some type of skeletal alignment based issue. It might be shoulders, it might be knees, it might be back, it might be neck, or something along the spinal cord. It could be elbows, it could be feet, a lot of ankle injuries as well. And with it, we need the right type of program. So it's been awesome to see so many people back again. Yes, we're handling it in a completely different way. Everything that we're doing is CDC guided in terms of doing the temperature checks, asking the questions, the social distancing, face coverings, keeping everybody safe and apart from each other with all the disinfectants and the hand sanitizers and everything else and the gloves. All of that, though, still we've been able to get to work and really start to put together the right program to improve your health, your body, your life, and decrease the risk of contracting COVID-19 or anything else for that matter. And it's been great. Now, I've had a couple questions come up, and that's from people that said, boy, I thought I was being somewhat active on my own. However, working with somebody again, in personal training, whether it's one-on-one or semi-private, and our semi-private is 6 or fewer people in one room, in doing that, my joints hurt. Are my joints hurting because I haven't done these types of exercises, or is it because of something bad still in my nutrition? And the answer to that is it may be both. Now, most likely we're going to start with the one thing, though, and that is we're doing exercises at a higher level of intensity than you might have been doing on your own. So if a joint somewhat hurts, it might be a shoulder, it might be a knee, it might be something. What's happening is we're working surrounding muscles, complementary muscles around the joint that haven't been worked or activated in a while. And we're doing it at a higher intensity than you would have been doing it on your own. It's only natural. One of the amazing benefits of working with somebody each and every time is the fact that you're going to do more than you would ever consider doing on your own for so many reasons. It's like that with everything in life. It's like that, and we see it in schooling. Zoom meetings are fine, but I think the big rub against distant learning and in the schools with Zoom meetings is the kids didn't have anywhere near the level of attention. And I know for a lot of people, it's a real hot topic right now because education, especially for our kids, is super important. But it's the same thing in everything. Every time you're working with a mentor or a coach, you're going to get more out of it. And it's an intelligent way to make sure that you're using your time wisely. You're able to get better results, and you're able to get better results without the risk of injury. So most likely that's what it is. It's the joint. It's the muscle that's being worked around it that hasn't been worked in a while. That should quickly dissipate. In terms of that soreness or that lactic acid delayed onset muscular soreness that might happen after a workout, it's going to last 2 to maybe 3 days. After that, it'll start dissipating. Regarding the nutritional element of that, and somebody asked me this question too, can eating carbs hurt my joints or increase arthritis? And the answer is, well, yes, of course it can. And it can because a sugar or a carbohydrate is always going to bind water to it. In fact, a carbohydrate is a carbon water, carbohydrate. And for every gram of carbon, you're going to hold 2 grams of water. You're going to feel that in your joints. Some people will feel it in their hands, especially if you're prone to more arthritis in your hands. Also, other people will certainly feel it in their knees. The knees are a big one, especially for women. You might feel the pressure in your knees. If that is, it certainly can be part of your diet. For men, it could be more spinal or it could be more shoulder. But yes, that can do it as well. And lastly, and this is a completely separate topic and we'll handle it later, is the fact that we could help dissipate some of that inflammation, not just by having the right diet, but taking the right supplements things like omega-3 fish oil can help decrease that inflammation, so all of those things. So I wanted to send this out as a message today. I wanted to talk about joint pain. I wanted to talk about why it can be happening, especially for a lot of clients that are being reintroduced to movement patterns and exercises that they haven't done in a very long time, way too long. And once again, I can't reiterate this enough. It's been great to be able to see people on a regular basis, not just once a month in my office for a scan and a nutritional consult, but more than that, to be able to work with them on their physical health on a regular basis, getting through all of the things that are necessary that we have to get through right now in order to improve your health. So it's been wonderful and it's been great, and I want to continue that whole process improving people's health. So hopefully today this video served you. I'm Dr. Derek Alessi, asking you to make the most of your life and live it fit.